This video is meant to provide you with essential information you will need concerning your liver transplant and the steps you will need to take care of yourself and new liver. You will need to play an active role in managing your own health during your recovery. There is a lot of information to learn. You and your support person should use this video as a useful reference tool. The chapters in this video will cover your transplant surgery, transplant medications, caring for yourself after transplant, and maintaining your long-term health. In this chapter, we'll explore how a liver transplant is performed and what happens immediately after transplant. For a liver transplant operation, you are taken to the operating room and put to sleep. The surgeons made an incision through your abdominal wall to completely remove your existing liver and replace it with a new healthy one. We connected your body's blood vessels, veins, and arteries to the new liver, as well as reconnecting the bile duct. Once these connections are made, the new liver starts working. After the transplant is complete, you are moved to the intensive care unit where you are monitored very closely. You may have IV lines in your neck and arms and a catheter in your bladder. You may have surgical tubes called drains in your abdomen. Your transplant team will let you know when these can be removed. Some patients may also need temporary help from a breathing machine or a dialysis machine. We monitor your condition with the help of blood samples and sometimes an ultrasound. Once your transplant team is certain that you are recovering well, you will be moved to the regular surgical floor.
Obviously I was really grateful afterwards. It was extremely overwhelming. It was extremely scary. I didn't really know what to expect, but the doctors were so nice, and the nurses and all the staff, they really took the time and explained everything, and they made it really easy and really comfortable.
You'll be discharged from the hospital when we see that your new liver is working well, you are eating properly, and you are able to get up and move around. You and your support person will need to understand all that will teach you about caring for yourself during your early recovery and beyond. Let's start with some things you should be on the lookout for once you are discharged from the hospital. There are some potential complications that can arise after your transplant, which include infection and rejection. Be watchful for these general symptoms of infection. A fever of 99 to 100 degrees that lasts for 24 hours or longer, or a new fever of over 101 degrees. Flu-like symptoms, which include body aches, chills, or generally not feeling well. Coughing or short of breath. Nausea, vomiting. Diarrhea. New or worsening weakness or fatigue, new or worse abdominal pain, confusion. Symptoms of wound infection include fever, redness or swelling around the wound, pus or odor coming from the wound or old drain site. Here are some steps you can take to prevent infection. Take your medications that prevent infection as instructed. Stay away from people with coughs, a cold, or the flu. Wash your hands often. Stay up to date with your vaccinations and your pet vaccinations. Do not change cat or bird litter without a mask and gloves. Your body's immune system is a defense system designed to fight off germs that cause infection. Rejection happens when your immune system sees your newly transplanted organ as foreign and attacks it. If this starts to happen, it does not mean that you will lose your transplanted organ. Recognizing rejection early is important so it can be treated. You will be on anti-rejection or immunosuppression medications to prevent rejection.
So after I got home from San Francisco to Sacramento, there was one point where I had to go back into the hospital. I went to a local hospital first, and they immediately put me in an ambulance and drove me to the California Pacific Medical Center, which they were really helpful. We thought I might have been a little bit of rejection, but it turned out I wasn't. They just gave me some meds, and I was all good to go and came home again.
Unfortunately, rejection does not always have symptoms. Your transplant team will watch your blood work carefully to check for rejection, so it is important for you to have your lab work done when instructed. The risk of rejection is highest in the first 3 months after your transplant. Symptoms of rejection include fever, a yellow coloring or jaundice of your skin or eyes, itching, clay-colored stools, weight gain, swelling of your legs or stomach, confusion. The best ways to prevent rejection is to follow your transplant team's guidance. Take your anti-rejection medication as instructed. Have your blood tests done when instructed. Call your coordinator if you have any symptoms of rejection or if you miss or make a mistake on your anti-rejection medications.
You get an outpatient transplant coordinator, and they are your lifeline. They are the ones that you call if you have questions. If you're just feeling funny, you'll want to call them after you get your blood work done, give them a heads up. They're your lifeline. They talk to your doctors for you, and they're always really helpful in there for you.
Remember, if you are having any symptoms of infection or rejection, or are in any way concerned, it is important for you to contact your transplant team immediately, especially in the first few days and weeks after your transplant. Remember that infection and rejection are treatable conditions, but need to be addressed as soon as possible. In this chapter, we'll explore the medications you'll be taking after your transplant. After your transplant operation, you will be taking many new medications. It is important that you learn about them and take them as instructed. Some of them you will need to take for the rest of your life. The doses of these new medications will be highest for the first 6 months after transplant, and then will be tapered down. If you have any medication allergies, let your transplant team know.
So after your transplant, you're on a lot of medications, and before you're released from the hospital, you need to memorize your medications, the names, and what they're for. The doctors and nurses are really helpful in explaining those to you. You have a little piece of paper that has the pictures of the medications, and so that helps you study a little bit. They give you what I call is a tackle box, and in your tackle box is filled with all your medications, and it's really scary and overwhelming at first, and now I just use this and it's like nothing. It's like you don't even think about it. It's just second nature to take your medications.
Many of your new medications will fall into 2 main categories. The first are anti-rejection medications, also known as immunosuppressive medications, which reduce your immune system and prevent your body from rejecting your new organ. As these medications reduce your immune system and make you more susceptible to infections, you will also take anti-infection medications, which will help prevent you from getting new infections after your transplant. Let's look at the specific medications you will be taking in each category. Tacrolimus, also known as Prograf or Hecoria, is a medication you will start taking and may need to take for the rest of your life. You'll take it twice daily. You'll need to avoid grapefruit or grapefruit juice, as it affects the level of this medication in your blood. We will test the level of this medication with your blood tests. It is very important to have your lab tests done before you take this medication in the morning, so we can measure your levels correctly. Tacrolimus can have some side effects, such as shaking, tremors, and headaches. Another anti-rejection medication you'll start taking is mycophenolate, also known as Celsep or Myfortic. This is taken twice a day. It may cause upset stomach, nausea, abdominal pain, or diarrhea. Mycophenolate can cause birth defects, so if you are a woman who is able to have children, you must be on birth control while taking this medication. You'll also be taking prednisone. Prednisone is a type of anti-rejection medication. You'll start taking it once a day. Side effects can be poor sleep, mood swings, and high blood sugar. Now the anti-infection medications. You'll be on medications to prevent several types of infection: fungal infections, viral infections, and bacterial infections. The first anti-infection medication on our list is nystatin, which helps prevent fungal infections in the mouth and throat. You'll take nystatin 4 times a day for the first 3 months. To take it, you swish it in your mouth for 15 seconds, then swallow it. Do not eat or drink anything for 15 minutes after taking it. Bactrim, also known as Septra, helps prevent bacterial pneumonia infection. You will take this twice a week, Monday and Thursday only. This medication will make you sensitive to the sun, so it is important to wear sunscreen. Another anti-infection medication is valganciclovir, also known as Valsite. You will be taking this medication for 3 to 6 months. Besides anti-rejection and anti-infection medications, you will also be prescribed several other medications to aid your recovery. You will be prescribed pain medications to help you control your pain after the transplant. Some may be strong morphine-based pain medications. You are not to take any nonsteroidal anti-inflammatory drugs called NSAIDs, such as Advil or Aleve for pain. You are also not to take any aspirin unless it is prescribed for you. While you are on strong pain medications, you may need to take stool softeners as directed to help with constipation. If your blood sugars are high, you may need to take insulin either temporarily or sometimes permanently after your transplant. You will be instructed by a nurse on how to check your blood sugars and how to take insulin. You will be given a medication list. This is to be kept up to date and used when taking your medications. It is important that you take only the medications on your list. Also, do not take any supplements, herbal remedies, or over-the-counter medications without first discussing them with the transplant team. The time you need to take your medications is clearly marked on the medication card. The medication box you receive before leaving the hospital has pill slots with the times marked to match your medication card. When you are leaving the hospital after your transplant, you will receive a month's supply of your medications to take with you. Your medications will be provided through a specialty pharmacy. It is very important to never run out of your medications, especially the anti-rejection medications. You are responsible for contacting the pharmacy for refills well before your medications run out. Contact the pharmacy for refills at least 1 week before you run out to allow time for it to be shipped to you. If you ever have trouble getting your medications or have any questions, call your transplant coordinator. After you receive your transplant and are released by the hospital, you can begin your recovery either temporarily staying close to the hospital or at home.
You know, one thing I remember about recovering was because I lived in Sacramento, which is so far away from California Pacific Medical Center, is they have an apartment right across the street that we were able to rent and stay there, and we walked across the street to the hospital every day to get my labs done and go to the clinic. And so it was really helpful.
There are many things that you should keep in mind during this recovery period, especially who to contact with concerns. Should a serious emergency arise, such as chest pain, significant shortness of breath, stroke symptoms, or any other extreme health concern, call 911 immediately. Notify your transplant team next, 415 600 1000. Should a non-emergency health concern arise, contact your assigned transplant coordinator during normal business hours. This could include symptoms of infection or rejection, or if you are having side effects from your medications. Even if you are uncertain about any symptoms, medications, or side effects, feel free to contact us, especially early after your transplant. It is important to record your temperature, pulse, and blood pressure as instructed by your transplant team.
About 6 months after my transplant, I started kind of to feel a little bit normal. For me, it took just about a year for me to start feeling really healthy and to start doing stuff again. But 10 years later, I love to hike and bike and swim and go boating, and I do everything or more that I did before my transplant. It's amazing.
After you leave the hospital, you will have a follow-up appointment twice a week in the transplant clinic in San Francisco on Monday and Thursday. As your condition improves, your appointments will become less frequent. Always bring your medication card, medication box, and daily monitor sheets to these appointments. You will also have lab tests done early in the morning on Monday and Thursday, so that the results will be available to your transplant doctors when you see them in the clinic. Remember that for your lab tests, your blood needs to be drawn before you take your medications. There is a liver transplant support group held twice a week on the same day as your transplant clinic appointment. This is for patient and support team members to attend.
So after your transplant, and sometimes before your transplant, your transplant coordinator or the doctors or nurses will suggest that you go to a transplant support group. I went after my transplant. I was wheeled down in a wheelchair. I was a little hesitant at going, I'll be honest, at first, but it was so helpful and it was amazing. And I got to ask a lot of, silly questions like, how long until I feel better, and how long until, I can sleep through the night, and how long until my back doesn't hurt. It was all questions that seemed very silly today, but then they were, it was very scary and it was very consuming. And once I got home after my transplant, I found a local support group. I go every month. I still go 10 years later. I still go to the support groups. I find them extremely helpful. And all the people there are great. It's like a second family.
The Liver Support Group is a place to learn from others who have gone through the same experience as you. A certain amount of activity and exercise is essential for your recovery process. However, there are some important guidelines.
Try to walk 3 or 4 times a day, but rest when tired. Do not lift anything more than 10 to 15 pounds for the first 6 to 8 weeks. No strenuous activity for the first 2 months, and do not drive for the first 2 months. Never drive while on pain medication. You can resume sexual activity once your transplant wound has healed and you are physically ready.
Your transplant wound will need care during your recovery. Your incision may have been closed with staples, stitches, or glue. If you have staples, they will usually be removed 3 weeks after transplant. Follow these guidelines for wound care until your wound is fully healed. Shower every day until your incision is completely healed. Do not take baths or sit in hot tubs. Do not scrub your wound. Do not apply lotions, powders, or creams to the wound. You can aid your body's transplant recovery by eating healthy foods and by following these guidelines. Work on developing a low cholesterol, low fat, and low salt diet. Eat whole grains, fruits, and vegetables. All dairy products, such as milk and cheese, should be pasteurized. Stay hydrated by drinking water. Avoid the following: do not eat grapefruit or drink grapefruit juice. Do not eat raw eggs, raw fish, or raw meat. Do not drink any alcohol. Your emotional health and well-being during your recovery is very important. Having a transplant brings forth many different emotions. Some of the medications you will be taking can also affect your emotions. It is important to share your feelings with your friends and family. Attending a transplant support group can be very helpful. Throughout your recovery, it is important to let your transplant team know if you are feeling emotionally down to the point that it's difficult to get through your day. This may be a sign of depression, which can be treated. We recommend that you invest in a medical alert bracelet once you are home. It gives first responders crucial information about you should you need their immediate aid. You will be provided a brochure and instructions on how to order yours before you leave the hospital. You should avoid significant long-distance travel until it is cleared by your physician. When you do travel, make sure you have enough medications to last you through your trip. As you adjust to life with your new organ, it is important to be proactive with health. In this chapter, we want to provide some information on how to stay healthy. While your transplant medications are necessary for keeping you healthy, some of these medications increase your risk for high blood pressure, high cholesterol, diabetes, heart disease, skin cancer and osteoporosis, or thinning of the bones. Maintaining a healthy weight through diet and exercise are very important to reduce your risk.
So after your transplant, you want to take very good care of yourself. You have a second chance at life, and it's very important that you eat healthy and exercise and take advantage of your new chance at life.
If you need help with your diet and exercise plan, talk to your primary care physician about a nutritionist who can help you on this journey. Keep up with all your regular health maintenance steps that you already take through your primary care physician, such as annual exams and lab tests like cholesterol testing, mammograms, pap smears, colonoscopies, and bone density testing. Stay up to date on vaccinations. Get a flu vaccination once a year and a pneumonia vaccination every 5 years. No live vaccinations are to be given to you. If you have any questions, ask your physician. The anti-rejection medications that you will be taking increase your risk of developing skin cancer. Reduce your risk by protecting your skin. Wear a hat and long-sleeve shirts. Use sunscreen of at least an SPF 30 rating. See a dermatologist every year to check your skin.
I remember when I was transplanted, they tell you, you can't be in the sun because of skin cancer and this and that. So I thought my life was over. Basically, I was like, I've got this big scar. I'm not going to be able to wear a two-piece bathing suit. And, they had a lady who was on the video come and talk to me in the hospital. And she goes, I go boating and I go swimming. And I was like, oh my gosh. You go in a bathing suit? Are you in a two-piece? Are you in a one-piece? Are you still in the sun? And she's like, life really goes on.
Many transplant patients are able to go back to work and transition off disability. Our transplant social worker can assist you through this process and answer any questions you may have. For women of childbearing age, you must consider a family planning or birth control method for a minimum of 1 year after your transplant. Some medications that you will be taking cause birth defects or miscarriages. If you choose to pursue pregnancy, discuss it with your transplant team before becoming pregnant.
When the doctors came in to tell me that I needed a transplant, they said, do you have any questions? My only question was, can I still have children? And the answer was, it's been known to happen. Keep in mind, this was 10 years ago. So 8 years ago, my dream came true, and I had, my first baby boy, and he was healthy and wonderful, and my pregnancy was really well. My transplant doctors were amazing to work with. They gave me their personal numbers, and they told me and my other doctors I could call them at any time. And this past year, I had my second daughter, who was also extremely healthy. It's been amazing. 10 years later, I'm healthy, and I've got 2 baby kids.
We have covered a lot of information in this video, and we hope it has been helpful. For more detailed instruction, you will receive a transplant handbook to read and use as a reference, as well as have a transplant coordinator review everything with you and your support one-on-one before you leave the hospital. Know that your transplant team is here to provide you with support and guidance through your transplant and recovery.